key speaker. And next slide, please. Representative Ann Johnson is a former chief human trafficking prosecutor, a current teacher and small business owner who works as an attorney in our criminal justice system for victims of sexual exploitation and those who cannot afford a lawyer. Ann is honored to have been elected to serve as state representative for Texas House District 134 in 2020. She won the Texas House Democratic Caucus Freshman of the Year and Texas House LGBTQ Caucus Freshman of the Year for the 87th legislative session. So we're so happy to have her with us, and I want to go ahead and turn it over to Representative Johnson.
Thank you so much. It is an honor to be with you all. I am grateful for your support, especially grateful for a number of the panelists on this call that were so helpful to me in this freshman session. I am proud of the work that we were able to do to advance many of the interests that you all are concerned with. I was grateful that I could support the provisions of telehealth and get that passed. These are some of the examples of things that we learned in COVID. We had to completely modify and change our behavior. And so hopefully the use of technology, just like we're doing today, the use of other methods of communication will allow people who were not able to get services or stability and often miss their appointment. Many therapists, psychologists, and psychiatrists, or maybe not psychiatrists, but psychologists have let me know that they were able to maintain the patient contact, and in fact, their rates increased. And so hopefully we'll continue to make advancements into making it easier to provide health services across the board. I was grateful to be part of the group on House Bill 133, which advanced an additional 6 months for postpartum issues for women, especially when we deal with issues of postpartum depression. I wish we could have had what we had out of the House, which was an expansion of a 12-month policy, but unfortunately the Senate was only willing to pass 6 months coverage and adding that group of individuals to Medicaid. So I'm glad that we got that step. In fact, if you watched us on the very last night, there were a few things that we were able to do right there at the wire, also including House Bill 290, which equally made good advancements for children and ensuring that children within a year were not locked off the rolls because of excessive income checks that could allow just a mistake in process and get them knocked off healthcare coverage. But we talked about it as a House, and we talked about the fact that we wanted more and we wish that the other side had been able to provide more, but we took what we could get. And so the reason I say that is I think it's a good start. We will never be over or have an excess in need in what you all are trying to do to provide mental health services. And so there's always going to be more. And so when I saw that your additional request is, well, what do we do for next session? These are the kinds of things that we need to build off of. I will say that I had been very proud of Speaker Phelan and his commitment to healthcare. I think he took a new approach. And those two provisions, postpartum and children's issues, were advanced because he made it a priority. And so I will thank him always for doing that. I hope that we can, again, gain more support on the other side and advance them further. We were able to do some additional good things, including getting additional funding in the Appropriations Committee, which I'm proud to be a part of, and expanding healthcare services across the state. I know that you all are looking for a new facility coming out of Dallas. We were able to provide additional funding to shore up UT Health and the Harris County Psychiatric Center and a new development there. And so one of the key issues that kept coming up for us during this session was this concern about the budget, because we all worried about the economic impact of COVID and what we would have available. And in all of those discussions, when we talked about COVID, you could not separate the impact of the necessity for mental health services. And so that's another thing that came from COVID, was the exposure to why mental health is so vitally important, and our concern that as kids go back to school or as we start returning to processes, that you all are going to be exposed to individuals who are going to need greater care. And so I am glad to see that there's going to be an additional $210 million in federal funding that is specifically going to be associated for behavioral health services, especially with regard to COVID relief. So those are good things. Again, I know it's not enough, but those are great starts. I will also say I'm grateful for the support that you all gave me on this call in recognizing and again, understanding a connection between our dual worlds. As you mentioned, I'm your former chief human trafficking prosecutor in Harris County. And so one of the challenges that I always saw, and one of the frustrations that I always saw, was that I was working with the juvenile population, adult population, and I got to a point working with this population for about a decade that probably like many of you, when you see the commonalities in patients, I can almost walk into the holdover and say that person is a victim of human trafficking. And it was almost the same story over and over again about abuse that had occurred at an earlier time. And really the psychological and emotional trauma that was impacting many young women, some men as well, and some boys. But really the fact that people think of human trafficking and they think of physical abuse and they think of bondage and they think of beatings, but that's actually more rare. What it really is the emotional abuse. It's the psychological manipulation. That's why I always thought we've got the greatest medical center, miles down the road. What do we have to do to try to partner and do some things? And so UT Health has been doing a lot with our care court and other services that are being provided. But I'm so grateful for the passage of House Bill 2633. And House Bill 2633 is a bill that we put up, got great support, bipartisan support, and it is dedicated to a public-private partnership for standalone facilities to engage in best practices of addressing acute trauma care and long-term mental health services and care for victims of human trafficking. And so I think it's really important, as you all know, of Maslow's hierarchy of needs. They have to have stability not only within a physical structure, their basic needs of health and food security, but also mental health. And so I'm grateful that UT Health was so supportive in helping us advance that. The model for that bill is so that other regions across the state can also accomplish those goals in the way that they see fit. I am grateful to be with you, and I will gladly answer any questions, but I also know you have an incredible group of panelists to talk to you about this session and where we need to go beyond. I will say that I am in DC and I am in Washington, DC, because we are in the middle of a quorum break on special session. I was honored to be put on the Speaker's Select Committee on Constitutional Rights to deal with the issues of bail reform and the vote suppression bill that was up. And I do say vote suppression bill because I sat there in 23 and a half hours of testimony, and what was most compelling for me was hearing from our disability community and the fact that many of the policies that were trying to be put in place may make it harder for them. And it made me think, as I sat there, about two of my nephews who are younger but have severe special needs, to the point of physical recognition of needs and both being effectively nonverbal. And they are two of the most important people in my life. And they are more than worthy of having a voice. And so when I think about the impact of what we do as public servants, I wholeheartedly believe that those are the voices that we are here to stand for the most. And so my commitment to you is to tell you that I will always stand up for what I believe is right and in protecting the vulnerable in whatever capacity it comes. It may not be something that we were expecting or a moment in time that we thought we would be in, but I do want you all to know that my purpose for what I am doing today is to advance the constitutional protections of all Texans, especially those that we may not be able to hear from. And so I thank you very much. I'm grateful to be with you. And again, I gladly answer questions or come back at another time when we get back to the Q&A.
Thank you so much, Representative Johnson. We are very grateful that you made the time to be here because I know you definitely have a lot going on. So we are not going to hold you any longer. Thank you so much. And we appreciate that open invitation and may very well take you back up on that offer for you to come back.
I'd love it.
All right. Thank you so much. Okay. We're going to go ahead and move into our panel. And so I'm going to ask Tim if he wouldn't mind giving us his big picture overview of the session.
Yeah, good afternoon, everyone, and thank you so much for joining us. We've got a great panel of experts on the issues that really matter the most. But I have to say, as Ann is jumping off, there was a great essay written years ago by Carl Sagan about patriotism, and he said, "Good patriots ask questions." And I got to tell you, Ann Johnson, newly elected state representative, first session, in my mind, is a great patriot because she asked really, really good questions throughout the process. And that's not a partisan issue. There's lots of good members on both sides of the aisle that know how to ask good questions. And I am always pleased when people come in, not acting like they know everything, but acting like they want to learn as much as they can, and they move forward doing so. And Ann Johnson was really a blessing in the legislature because that's exactly what she did. So I feel fortunate that we were able to have her on because reporting from Washington is kind of a good little segue to give you an idea of how crazy this year has been. And I don't need to tell any of you on this phone call how crazy the year has been and how difficult it has been on so many levels. But when it comes to the legislature, there has never been, in my memory, and I'm looking and I see a lot of familiar faces. I've been involved in almost every session since 1993, and there has never been a session like this before. It started with absolutely nothing for 2 months because COVID was still raging in January and February. The legislature constitutionally showed up and then promptly recessed week after week until we could figure out a safe way to get into the Capitol. They didn't start having any sort of budget hearings or anything else. None of the interim work that would have been done building up to this session occurred. And when I say it didn't occur, I'm not saying like they just didn't have public hearings, that the studies and all the budget work and a lot of the things that go on by both the legislators and their staff simply didn't happen because of COVID. And then from the side, from those of us who work in advocacy and try to get in and move our issues, it was extremely difficult to get in front of anyone, be it virtually or anything else, to let them know what our priorities were. Of course, if you guys remember January and February, that was when the promise of the vaccine was coming out and people were getting excited about it, and the elderly folks were getting the first shots. But in reality, most of the people weren't getting shots, and that are in the legislature until March. So we all knew that things were going to kind of shoot out like a gun when we finally had a chance to get going. But there were some big hurdles in front of us. We didn't know what the economy was doing. If you remember a year ago at this time, the comptroller had come out and said that the state, instead of having a $4 billion surplus, as was planned by the previous legislature, was facing up to a $5 to $6 billion deficit, which was going to be a tremendous impact on the budget. There was a lot of hand wringing about what kind of what we were going to do to make up all the holes in the budget. Well, a couple of things happened that caused what I call kind of a surprising recovery. Is back in 2017, we passed a little bill that said sales tax applies to things bought and sold on the internet. And so sure enough, all that tax revenue that we would have missed prior to that bill passing ended up in the state of Texas, so that there was adequate resources for spending on things like mental health and healthcare and women's health. All these issues that need government funding were not, surprisingly, when the comptroller made his presentation in early February and went around the Capitol. I visited with him personally. Of course, we were all double masked. You had to get your nose swabbed to even go in the Capitol. It was the craziest thing you've ever seen. And the security was extremely tight because the January 6th mess had happened, and so the state National Guard was out on scene at the Capitol. It was the most bizarre session I've ever seen. But all of a sudden the budget was okay, and everybody's looking around like, okay, one less thing. We don't have to worry about that. We're gonna be able to balance the budget without any sort of major hiccups. The House and the Senate very quickly kind of came to an agreement that things were going to move forward, and that there weren't going to be these big battles of where the cuts were going to be. And so you kind of felt like right towards the end of February, like, okay, sessions, we're going to have a regular session. And then everyone, I'm sure, on this phone call remembers the ice storm. And I've never seen a legislature literally turn on a dime and go from everything that it was expected to talk about, public health, COVID, budget, issues like that, to grid reliability. Most people probably didn't even know what ERCOT stood for prior to that storm. And now, yeah, I see Lisa. Yes, there's a few of you that knew what that was, but the PUC, now, of course, everybody knows what that is. And every committee stopped what they were doing and started holding hearings. If it was the education committee, it was what did the storm do to the education system? If it was the, well, of course, all the oversight committees for PUC and ERCOT and all these other things started having hearings. But even the Health and Human Services Committee was talking about what kind of impact the grid meltdown had on the hospital. So pretty much most of March was lost to all sorts of press conferences and people losing their board positions. And we found out that many of the members that were on the PUC and ERCOT were from out of state, and they lost their board position. Either they were asked to resign or they quit entirely. So there was all sorts of just strange things. So when we talk about our issues, we were trying to feed them in between all this craziness. But then really towards the end of March, most of us were getting our shots. And when I say most of us, the legislators and their staff and the advocates that were in the building started having our vaccine card that said we had 2 shots. And so we were able to go into the Capitol without quite the rigmarole of testing. And then lo and behold, the leadership decided that we've got these slew of bills that we have to do because the polls in our base are telling us we have to do them. And the Second Amendment bill took up almost a week worth of debate on both sides of the House and the Senate. Election integrity is still going on, and voter rights and this back and forth on that issue. Then the committee started a big push to put in abortion bills, and then the Dallas Mavericks apparently didn't play the national anthem, so we had to spend a whole day debating whether teams that were playing in publicly funded event centers had to play the national anthem. And then towards the end of session, these what I call red meat bills that were driven clearly by polls. No one really had a big policy agenda. There wasn't a whole lot of campaign work or things that had gone on prior to it, but by God, the polls said that they had to act on these things, and so they were going to do that. And both sides of the legislature started pushing these bills through. The high school critical race theory debate launched in. Again, most people probably didn't even know what critical race theory was. I knew lots of people that were like, I had to Google it, figure out what it was. And the idea of teaching what racism is in our history became a focal point and continues to be a focal point in the special session. And then there was another day where we lost because they wanted to talk about the trans children competing in the UIL. And so the House and the Senate both spent almost an entire day debating bills about that. And as a lobbyist, I can tell you, even we got brought into this, which isn't a surprise, by the way, because as I joke with a lot of my friends, being a lobbyist is the only profession that ranks below trial lawyers in public opinion polls. So it's easy to beat up on the lobbyists, but they said publicly funded lobbyists, so lobbyists who represent cities and counties should not be allowed to lobby on certain things. And so there was a big bill about that. And so when we talk about the issues that we care about, our issues were very rarely out front. We were not able to push mental health because all the attention of the media surrounding the legislature, all the attention was around these big, what I call red meat bills. But that's what's really pretty cool about what this team was able to do, from Brenda and Sydney and the whole bunch, and a lot of people across the state, was that even with all this noise, there were a lot of things that were accomplished. So I'm going to throw it to some of my other panelists and let them really dive into the things. But you have to understand that what is normally a 140-day session, in essence, we had maybe 35 days in the total 140 days where we were able to get work done and get things and our issues really attended to. So with that, I think I'm supposed to throw it over to Amanda. Amanda, you're up next.
Thank you, Tim. I would concur with Tim's characterizations of this session. It is clearly, I think I'll go out on a limb and say it's the most surreal legislative session that we'll probably experience in our lifetime. And it also appears to be the session that won't end. So I'm just going to jump right in. And I included a few slides on the Harris Center, but I wanted to jump right in on the 1115 waiver, which has been a roller coaster. So going into session, as a behavioral health provider, a local mental health authority, it's a top issue going into the session. And are the Delivery System Reform Incentive Payment Program, known as DSRIP, ends this year. So the pressure was on. At stake was more than $366 million statewide for behavioral health services in fiscal year 2020. That's about 1/3 of all of the public adult mental health funding. The Harris Center is a big dog in the hunt. We drew down $86 million in year 2020. So it's a big deal. The waiver extension that the state developed would basically take the place of the loss of DSRIP. Not a lot of gains, but would make us whole for the most part. There were two pieces of that: the charity care pool and the state directed payment program. It was limited as to what providers were eligible for those funding streams. Then on January 15th, the federal government approved the waiver extension. We said, yes, it was early in the session. That was an incredible victory. But 3 months later, on a Friday, we received news that the federal government had rescinded the approval. That was not a good weekend for us. So since then, there's been a lot going on. The Attorney General has filed suit against the federal government about the rescission of the waiver. Simultaneously, HHSC has indicated to the federal government of its intent to resubmit the waiver in the same, including the same context that it was created before. There have been a series of public hearings this summer. I know many of you have participated in them. I feel optimistic about this. I think that, when there's likely two paths. One is that the waiver will be resubmitted to the federal government and approved. Second, there could be some relief in court on the AG's case. Thirdly, I guess is nothing could happen, which would be an absolute disaster for our behavioral health system. I don't think that's going to happen. I'd like to ask Tim, because he has somewhat of a different lens on this, to add to this discussion.
Sure. One of the things, Amanda, I'd like to kind of clarify for everybody is with Medicaid, when you do what's called a state plan amendment, those are generally what I kind of call check the box requests. And you basically tell the federal government, under the Medicaid law, we want to do X, Y, and Z. Here's how much money it's going to cost, and it's in compliance with existing law. And if it complies with law and the budget neutrality, then the federal government literally goes, yep, check, you're approved, go ahead. There's really no negotiation to it. With an 1115 waiver, these are much more of what I almost call an old-fashioned negotiation, where the governor and the head of HHSC tend to sit down at a table, and the commissioner or the Secretary of Health and Human Services and the CMS director sit down on the other side of the table at the federal level, and they work out a waiver. And I've been involved in waivers all the way back to the 90s. I remember learning about the original Arizona 1115 waiver. All of these things are negotiated. Every waiver prior to this one that was just sent up have only been limited to 5 years. So when the Trump administration, on their way out the door, literally Seema Verma signed the extension for 10 years at 4:30 p.m. and submitted her resignation at 5 p.m. that night. When that all happened, there were a lot of people that were left kind of scratching their heads like, wow, I didn't even know they could do 10 years. And the money doesn't seem to be really clear in it. So there's going to be some things. And so most of us that were involved with the 1115 waiver process had a pretty good feeling that the Biden administration was going to rescind that approval. We just didn't know when. We had heard that they were going to do it in the summertime. They did it right in the middle of session, which of course threw everyone into a bit of disarray. So my crystal ball says we'll probably get a 2 to 5 year extension. In some of the conversations that I've heard, I think the money will flow. How these direct payment programs are going to work is still up in the air. And the big frustration is they wanted to roll out September 1, and we don't even understand whether or not things have been approved. So there's a lot of unknowns left in this process, and how the Biden administration negotiates with the Abbott administration will determine how this Medicaid waiver. And I have to remind people, the original Medicaid waiver was negotiated, at least started to be negotiated by the Governor Perry administration with the Obama administration. So these are two new administrations that are trying to come to some common ground. And so we'll be watching very closely as to how this goes through. It was, interestingly enough, rescinded on a technicality. It wasn't actually rescinded on any substance. The letter that went with it basically said, you guys didn't even follow the process right, so go back and follow the process, and then we'll negotiate what's in the waiver. And so the negotiation is likely only going to be to get started later this summer, and how it rolls out and where the money flows is anybody's best guess right now. But knowing the people that are involved, I don't think that the idea that it'll somehow go to zero is realistic. I think there will be money flowing. I think that particularly the mental health components of it will be well funded. That piece was supported both at the federal and the state level by both Republicans and Democrats. So I don't think that's the bigger issue at play. So it'll be interesting to see how this one plays out. But the story, I would say we're on chapter 7 of a 10-chapter book. So we still got 3 more chapters to read.
Thank you. So I wanted to take a moment for everybody to pat themselves on the back. You know, despite everything that was going on this session, our leaders recognize the importance of behavioral health, and that's due to all the hard work that we've done in educating our legislators. So thank you for what you do, and keep up the good fight. And it was because of all that work that mental health services largely avoided any cuts this session, and that the legislature continued their investment into those programs. Next slide, please. And not only did we maintain our services for adult mental health, children's services, crisis services, matching grants, we received some new funding to create multi-systemic therapy teams in Harris County for youth that are involved in the justice and CPS systems. There's a study to implement 988 suicide hotline, which we're very excited about. There's new money for a new Medicaid benefit, applied behavioral analysis for individuals with autism spectrum disorder. That implementation could be sooner, but no later than February of 22. There were big gains on the hospital side, as Representative Johnson said. Next slide, please. In our local community, UT Health received more than $40 million for 168 beds, which is 7 units for its remodel, for its part in the upgrade and remodernization of the state hospital. I've heard that it might see its first patient as early as February of next year. In addition, the legislature funded $30 million for the purchase of private psychiatric beds. Next slide. A new piece that passed through the legislative process was a rider that requires the Health and Human Services Commission to apply to the federal government for a waiver to receive federal matching dollars for services provided to Medicaid eligible persons during short stays in institutes for mental disease. This is the IMD exception to Medicaid, and frankly, this could be a game changer. The implementation of this is something we'll be watching very closely, and we would advise our inpatient providers to keep a close eye on this, on the implementation as well. There are two pieces that are focusing on step-down housing pilots for individuals with serious mental illness and a study of the step-down services. HHSC is also going to fund several pilot sites around the state for these step-down services, and the Harris Center is going to be one of them. Next slide. Switching to housing, House Bill 3088 by Representative Coleman addresses difficulties that communities have had raising private dollar match in the Healthy Community Collaboratives program. The Healthy Community Collaborative program is a program for services with individuals with serious mental illness who are also homeless. The bill relaxes the match percentage for some of the smaller communities, and for all of the communities, it allows local funds or local in-kind funds to be used as match in addition to private dollars. Next slide. On the CPS side, there were a couple of bills of interest. House Bill 3041 by Frank creates the Family Preservation Services Pilot Program. What this does is it allows the state to use funds that could only be used for children in foster care to serve children who are at risk of being removed from their homes. These funds can be used to provide services to the child and to the family so that the child can safely remain in the home. The state is going to select two pilot sites, one in an urban area and one in a non-urban area. Senate Bill 642 is a significant one in that it allows local mental health authorities to make direct referrals into the relinquishment avoidance program. And the state is in the midst of implementing this program right now. Next slide. A couple other bills of interest. Senate Bill 49 changes the requirements of the 1622 interviews, which is in the Code of Criminal Procedure, which requires magistrates to order local mental health authorities to conduct an interview of all defendants who may be a person with mental illness or intellectual disability. We were running into problems once a person bonded out in locating them in the community under current law, in particular if the person didn't have a telephone or was homeless or had some sort of housing instability. So this bill changed that requirement, and now these interviews are only required if the individual is in custody. House Bill 1616 addresses workforce issues and makes it easier for physicians to get a license in a different state through the Interstate Medical Licensure Compact. And lastly, a very interesting bill is House Bill 1802. And this bill requires HHSC, Baylor College of Medicine, and a veterans hospital to study the use of alternative treatments for certain mental illnesses. These treatments include psilocybin, MDMA, and ketamine to study the treatment of PTSD in veterans. People that have been involved in this, really think the use of these treatments can be, a game changer. And there's a lot of excitement about this bill. Andrea. I think you're on mute.
Okay, well, thank you so much, Amanda. We're going to go ahead and ask Brenda to please give an overview of some other mental health legislation.
Okay, thank you so much for inviting us. And I want to begin by acknowledging the fact that without this, the help of WellPath Recovery Solutions, I couldn't do all the time that I've spent on legislative initiatives, especially from the perspective of NAMI. Next slide, please. So I want to start with giving credit to NAMI Texas and the 28 other affiliates. Some of you may not know that NAMI has 29 affiliates within the state of Texas. And this is a quote from Greg Hanch, our executive director, who says, despite mixed results, NAMI Texas fought hard to improve the quality and timeliness of care provided to individuals living with mental health concerns and their family. The policy team, our policy team, provided testimony on 17 bills. They registered in support of 160 more, but there are lots of time that they're spent in weekly stakeholder coalition meetings trying to get us to the point where we had the ability to get those bills passed. Now, we also had 4 days of action, for those that don't know, where NAMI affiliates literally gathered people that were constituents to members of both the House and the Senate and spent time with them on the phone and in person in order to have them understand that NAMI was out here and which bills we really supported. Next slide. So I wanted to talk about our successes, and some of these you've heard about, so I won't go into a lot of them. The first one, which it was a rider to the Department of Criminal Justice. For those of you that don't know about Tacoma, it used to be the Texas Council, it's now the Texas, I think, Criminal Office or for individuals with mental and medical impairments. And that particular thing is for continuity of care. It ensures that they can continue to collaborate with DSHS, and that this is really important in terms of having the dollars available. Senate Bill 49, Zaffarini, I think you just heard from Amanda as to how important that was in implementing some of those provisions within the criminal code that we really had not had the ability to ensure that people with mental illnesses were able to bond out or be dealt with through the bond process. And that includes individuals with intellectual disabilities as well. House Bill 1694 is important because it is a NAMI championed bill. This means this is one where we did all that we could in talking to the people who were sponsoring it, as well as spending time with the staffers, as well as helping with some of the details in the bill relating to the defense to prosecution. And this, as it relates to marijuana especially, this was something that we were a part of for people seeking assistance following an overdose. House Bill 549 was also important to us. This is Thompson's bill. Some of you may know that in other states, there's something called a Tarasoff protection, where individuals who are the primary mental health or other providers for an individual, if they tell people that they are in danger, they are not liable for having done that, which is outside of the HIPAA regulations. We did not have that in Texas. And so now under House Bill 549, it allows mental health professionals to, in fact, notify individuals who may be in danger as a function of something that is happening within their person with mental illness. And this is really important, especially since we don't have any red flag laws. I'll add that we have no red flag laws, and now we have the ability for people to obtain weapons. And this also is interesting because if the individual tells their primary provider that in fact they're concerned about taking their own lives, families would have no way of knowing under HIPAA that they needed to remove weapons. So this is another good thing. Okay, next slide. This is another one that, in fact, we helped with, meaning we being NAMI, relating to the availability of antipsychotic prescriptions under the vendor drug program with Medicaid managed care. Some of you may or may not know that there's this requirement to keep documenting that the person needs the medication, and that always delays their access to the medication. So this particular bill fixes that. So once it's shown that they were not successful on a medication, they don't have to keep doing that again, but rather are able to obtain additional medication without going through the same process. House Bill 2595 by Price is another one where it relates to parity. And for some of you who may not know, parity, of course, is something that we say exists for, if you say you break your leg, you get treatment. If you have a mental illness, sometimes the treatment is not as readily available, even for those who are insured. And this complaint portal allows the Department of Insurance to have some oversight, which for the most part, there has not been a way to actually track those complaints, even though they've come into the Department of Insurance. Senate Bill 500 relates to the criminal offense for operating a boarding facility without a permit in those counties where it's required. And if you know some of the terrible things that have happened in boarding homes to people, then you understand why we would be very concerned, but see this as a success because Harris County does have the ability to regulate boarding homes. Senate Bill 1, this portion of it, of course, Senate Bill 1 is so large that we had to take out the small portions of it. This relates to the Section 811 housing and an increase there in funding. House Bill 3821 relates to employing and training mental health professionals for mental health programs for veterans. And this is important because we need more people who are especially aware of how do you deal effectively with veterans. And NAMI, of course, is very interested in that to the extent that we have a process called Homefront that is one of our support processes for families and for individuals who are veterans. Now go on to the next slide. So instead of saying failures, I thought I'd say not successful this time as a way of looking at it, but it's this time that we weren't successful. And so the first one is relating to group health insurance plan for early treatment of first episode psychosis. This was very important to us. And as you know, if we can get people early on, we have less of a problem of them decompensating to the point where it's very, very difficult to get them back and being a functioning member of society. Another one that we hoped for but did not get was House Bill 787 relating to the conditions of community supervision, prohibiting contact with certain persons. What happens is individuals with a criminal past were not able to help as peers because of certain requirements for their working with individuals who might have had a mental illness or may have a mental illness. This was important to us to have a way for people to be good, productive peers, and that bill did not pass this time. House Bill 2751 by Mesa relating to the use of administrative segregation by the Department of Criminal Justice. There was a tremendous amount of testimony on this bill. And when you realize that administrative segregation or segregation at any point when a person has a serious mental illness, or even prior to that, if they have the predisposition, then in fact, they become much worse when they are in segregation. And so many people severely decompensate as a function of that. We had hoped to get that as a process, but not this time, maybe next time. And then House Bill 4354 by Coleman, which is another NAMI assisted and NAMI championed bill relating to the administration of medication to certain persons in the custody of a sheriff. And this bill would require jail physicians to document any justification for switching the medication. Well, why is that important? It's because if a person comes back to the jail or comes to the jail having been stabilized on a medication, and it can be shown that that was the medication they were stabilized on, the sheriff would in fact normally use that medication, but sometimes the physician will change it. They may have a physician that's not familiar with it or thinks it's too costly. So this was one way we had hoped to be able to stop that, the switching with that. So next slide. Okay, I'm going to try and whip through this, but these are things that hopefully we'll get next time. The most important, I think, out of these, you can read them, and I'm sure this will be available to you. The PowerPoint will be, but the creation of the Office of Forensic Services, we had great hopes for that, didn't get it. The criminal trespass citation, which, believe it or not, was a Betancourt bill, which would be just a citation or a Class B misdemeanor if a person is there, and most of our folks are jailed on things like criminal trespass. There are a number of other bills, 1646, the rider for clubhouses, and Senate Bill 1, which did not, the clubhouse is there, but the $1 million for clubhouses did not get passed. But my understanding is that HHSC is going to take care of that, and there will be funding there. The last thing is the general appropriations for the rate for peer services. We had hoped for an increase there. That did not happen. And just one more, and I'm going to try and stop at that. These are some that are things, especially the Office of Health Equity, which is important, and the implicit bias training, which you know probably wouldn't go because it's that thing that people think is critical race theory, which is not. And related to the provision of recovery community organizations, peer-to-peer services under Medicaid. It's critical because these recovery community organizations have really been the backbone of providing peers and others with the training they need and with getting people sober. So that's all of mine. So sorry, tried to go as fast as I could.
Thank you so much, Brenda. And our last panelist, I'm going to ask to come, is Lisa Pointer with the Fort Bend Regional Council on Substance Abuse. Lisa?
Good afternoon, everybody. I am delighted to have the opportunity to speak to you about one of my favorite subjects is politics. I also will move through rather rapidly to get us on time for some questions. So if you'll go to the first slide, please. So substance abuse funding received near a $32 million increase in funding. I will point out, however, that this does not necessarily translate to an increase in funding in direct services. And of note, the specialized female services that were expanded in session before was not funded. However, it is widely believed and widely discussed that those loss of funds will be backfilled with either the CARES Act or the ARPA Act funds. Next slide. SB 1827 by Huffman, the creation of an opioid abatement account for funds received from the statewide opiate settlement agreement. And basically, this bill codifies the settlement agreement. It establishes a 14-person member opioid abatement fund that is administratively attached to the comptroller's office. Now, there's a lot of history on why it's not the Attorney General's office and the comptrollers, but I'm going to leave that for a little later discussion. It requires that 15% of the entire settlement be set aside and deposited into an account that would be appropriated to state agencies, and the remaining 85% of the opioid funds would be distributed to those that are party to the lawsuit, particularly counties and municipalities. It restricts funding from the opioid abatement account to specific opioid use disorder services. And what's important about that is sometimes in Texas, funds kind of get transferred maybe off to another area. And this does a good job of saying specifically, this is what we're going to do with those funds. And they'll be overseen by the 14-member panel. Next slide, please. HB 133 by Rose. This is a really, really big deal for women in Texas on Medicaid. It expands their coverage from initially 3 months, which the current law says, to 6 months. I bring it up in my part of the slides because I also think it will be used to backfill some of the loss of the specialized female services. It is going to have a massive impact on postpartum depression, among other medical services. Next slide, please. HB4 by Price, what is affectionately known as the telehealth bill. This is the biggest change in telehealth, telemedicine in many, many, many years. And it states that it gives Medicaid recipients, along with CHIP enrollees and those receiving benefits from other public benefits, the opportunity to participate in telehealth. This is huge. It also, which was very important to the behavioral health care providers, it allows for audio-only technology. One of the other interesting things about this is that the entire bill is really prefaced by, requires HHHC by rule to do all of these things. And of course, that's not done yet, and we don't know what that's going to look like. I want to compliment the network of behavioral health providers for supporting the chemical dependency outpatient treatment telehealth addition, where it assures, regardless of what licensure says that substance abuse treatment facilities can do, that we can in fact do telehealth services. What's not in this bill is that counselor interns can provide telehealth services in substance abuse treatment facilities beyond the emergency rule. Next slide. SB 2313 by Hinojosa. In the Association of Substance Abuse Program, this bill is affectionately referred to as Bill's bill. That would be Bill Bailey of Synacor. A couple of years ago, there was a change in the administrative rules for substance abuse treatment facilities that says that they can fine treatment facilities up to $25,000, and that is the extent of the information we know. We have, as a field, experienced massive fines that appear to be set at the discretion of individual auditors. So my gratitude to Bill Bailey of Synacor. Next slide, please. HB 707 by Moody, Recovery Housing Study. You might remember this bill from last session. We did get it through this year, and I think probably the biggest difference between this bill and last session's bill was it does define recovery housing. It sets aside recovery housing from boarding homes, any other type of not so regulated type of housing. Next slide, please. HB 1694 by Rainey, the Good Samaritan Law. So we've been working on this one for many sessions. We've not been successful. Advocates did get it through this year, but it is very, very, very watered down. It has very specific requirements as to who could benefit from calling law enforcement and medical care for people overdosing. I'm going to not get too detailed on that, and then when Andrea sends the slides out, you'll be able to read that. And next slide. I think we're wrapping it up. Andrea, it's back to you.
All right, perfect. Thank you all so much. I mean, there was a lot to cover for sure. And so I want to thank all of the panelists for taking the time to provide that information to our participants. And so maybe in the last couple of minutes that we have, want to know if there are any questions from any of the participants. If you can feel free to put any questions in the chat, or you can unmute yourselves and ask a question. And if there are no, I have one, a final question if I don't see any that are coming in the chat. Okay, I was rushing people to make time for questions. Well, my final question to the panelists is, yes, this was a bizarre session. Everyone has affirmed that. We have no idea. Well, yeah, it's still ongoing and threatens to potentially go for several more months. These special sessions, depending on how all that turns out. What do advocates need to be doing now? So, you know, we can come back stronger. Some of these missed opportunities we've talked about, we can go after those in the 88th legislative session.
Well, I would jump in and say that it's very important to collect data and to back everything that you ask for with data. Have cost estimates with it, you know, studies, you know, that's very important. You know, not just to say that we need this, but to actually show the need. You know, I just saw an article today that there was a 29% increase in the number of overdoses compared to 2019. You know, and we're expecting a similar surge in mental health, the need for mental health services. So, you know, keeping an eye on the data is very important. And, you know, just keep contacting your members. Those relationships are important. And, you know, we've got another opportunity coming up with the redistricting session with billions of federal dollars on the table. So I think that you know, that we'll probably all be engaged in that session too.
If I could add to that, Amanda, I totally agree with you. Data is super powerful, but never underestimate the power of stories. And if you come across an anecdote, a story, you have a young person in your treatment facility whose family has, you know, et cetera, et cetera. And some of those stories really are a perfect caveat of what happens when people don't get timely services or get treated poorly by the system before they finally get some help. Those caveats, and of course, de-identifying, make sure you're HIPAA compliant and all that kind of stuff, but consolidating stories like that and sending them to Andrea or so that she can kind of keep them, or Brenda, you know, any of us. Those stories are very, very powerful in the legislature. Even if you don't have the person who you think may come and testify themselves, allowing us to tell those stories gets a lot through. And it's a much more of an art than a science. Some legislators are very data oriented, and to Amanda's point, they want to know the ins and outs of the entire system. Other ones don't want to know that until they're convinced enough to care because of stories. So don't underestimate the power of stories. And then, quite frankly, take a little time away from this stuff, because it can absolutely be the most frustrating thing in the world. And we need your energy. We need you in 2023. Where that's the next big shot of legislative change, where we have the chance. And if you do this every day, you can burn out. So take care of yourself, do a little self-care along the way. And let's be ready to turn it up another notch when we need to do that down the road.
And I just wanted to kind of go along with what both Amanda and Tim have said. We do need to have the data. That's one of the reasons why we can get shut down. If we don't really have the data and we go in and make the big ask, it doesn't always work. But at the same point, I have seen legislators brought to tears as they hear the impassioned stories of those individuals that where the families and the individual have done so much and come through so much by they're not having the access. And every time you see that Texas is 50 out of 51, with there being the District of Columbia included, anytime we're 50 out of 51, we're only ahead of Georgia in terms of access. This says that even with all of this, we're not back to where we need to be.
Thank you. Well, again, thank you to all the panelists. Thank you to our participants. We will be sending out this PowerPoint to everyone. And just thank you for your participation. Have a great weekend.
Thank you for having us.
Thanks, everybody.